If you're a man over 50 and you've noticed things just aren't working the way they used to in the bedroom, you might be dismissing it as normal aging. But what if I told you that what you're experiencing isn't inevitable, and it's actually your body sending you urgent warning signals that your testosterone has dropped to dangerously low levels? Most men wait years before getting tested, thinking it's just stress, fatigue, or getting older. But here's the truth. Low testosterone doesn't just affect your sex drive. It's systematically destroying your muscle mass, your bone density, your mental clarity, and yes, your ability to perform in the bedroom. And the signs show up there first, long before you notice them anywhere else. I'm going to walk you through 7 specific bedroom signs that indicate your testosterone has dropped to levels that require immediate attention. These aren't vague symptoms. These are precise, measurable changes that urologists and endocrinologists use to identify hormonal decline. And sign number 4 is the one that 90% of men completely miss because they attribute it to something else entirely. Before we start, drop a comment below telling us where you're watching from and how old you are. And if you've noticed any changes in your sexual function, energy, or drive over the past few years, let us know. We rate every comment and reply with personalized advice. Now here's something that will shock you. A study published in the Journal of Clinical Endocrinology and Metabolism found that over 40% of men over age 45 have testosterone levels below the healthy range, but only 12% have been diagnosed and treated. That means millions of men are walking around with a treatable hormonal deficiency that's destroying their quality of life, and they have no idea. The reason most men miss these signs is simple. Testosterone decline is gradual. It doesn't happen overnight. You lose about 1 to 2% per year after age 30. By the time you hit 50 or 60, you might be sitting at 40 to 50% of what you had in your prime. And because the decline is so slow, you adjust and normalize each stage without realizing how far you've fallen. But your bedroom performance doesn't lie. The signs show up there with brutal clarity because sexual function is one of the most testosterone-dependent systems in the male body. Let's go through all 7 signs, and I'll explain exactly what's happening physiologically and what you need to do about it. Starting with number 7, decreased morning erections or complete absence of morning wood. If you're waking up without erections most mornings, that's not normal aging. That's a red flag. Morning erections, what doctors call nocturnal penile tumescence, happen during REM sleep when testosterone levels naturally peak. A healthy man experiences 3 to 5 erections per night during sleep, completely independent of sexual thoughts or stimulation. These erections serve a critical physiological function. They oxygenate the erectile tissue, keeping it healthy and elastic. When testosterone drops too low, these spontaneous erections decrease or stop entirely. A study in the Journal of Sexual Medicine found that men with testosterone levels below 300 nanograms per deciliter had 73% fewer nocturnal erections compared to men with normal levels. If you used to wake up with strong morning erections regularly, and now it happens rarely or never, that's your body telling you testosterone production during sleep has declined significantly. This isn't just about sex. It's about the health of your vascular and erectile tissue. Without those nightly erections, the tissue begins to atrophy, leading to permanent erectile dysfunction over time. Number 6, significantly reduced sexual desire or libido that's persistent, not occasional. Every man has periods of lower interest due to stress, fatigue, or life circumstances. But if you've noticed a sustained, months-long drop in your desire for sex, where you're rarely or never thinking about it, rarely initiating, and feeling indifferent when opportunities arise, that's a hormonal issue, not a psychological one. Testosterone is the primary driver of libido in men. It acts directly on brain receptors that control sexual desire and motivation. When levels drop below approximately 350 nanograms per deciliter, libido typically declines noticeably. Below 250, it often disappears almost entirely. Research from the New England Journal of Medicine found that men with low testosterone reported sexual thoughts less than twice per week, compared to multiple times per day in men with normal levels. Here's how to tell if it's hormonal versus situational. If you're still attracted to your partner, if you can still become aroused when directly stimulated, but you just don't think about sex, don't seek it out, and feel like you could easily go weeks or months without it, that's low testosterone. If you've also noticed decreased motivation in other areas of your life, less drive at work, less interest in hobbies, that further confirms it's hormonal because testosterone affects overall drive and motivation, not just sexual desire. Number 5, difficulty achieving or maintaining erections firm enough for penetration. This is the sign most men recognize, but what they don't realize is that erectile dysfunction is often the first measurable symptom of declining testosterone, sometimes appearing 5 to 10 years before other symptoms become obvious. Testosterone plays multiple roles in erectile function. It stimulates nitric oxide production in the endothelial cells lining your blood vessels. Nitric oxide is the molecule that signals arteries to dilate and allow blood to flow into the erectile tissue. Without adequate testosterone, nitric oxide production drops, and your blood vessels can't relax properly. Testosterone also maintains the health and sensitivity of nerve receptors in erectile tissue and supports the production of key neurotransmitters involved in arousal. A landmark study published in the International Journal of Impotence Research found that 35% of men with erectile dysfunction had testosterone levels below 300 nanograms per deciliter, and when their testosterone was restored to normal ranges, 68% experienced significant improvement in erectile function without any other intervention. Here's the key distinction. If you can still get erections during masturbation or with visual stimulation, but struggle during partnered sex, that's often psychological or performance anxiety. But if you're having difficulty achieving firmness even when alone, if erections are noticeably softer than they used to be, and if you're losing firmness during sex, that's vascular and hormonal, not mental. Number 4, and this is the one that 90% of men completely miss, dramatically reduced volume of ejaculation and weaker orgasm intensity. Most men never connect these changes to testosterone, but they're actually some of the most reliable indicators of hormonal decline. Testosterone directly stimulates the seminal vesicles and prostate gland to produce the fluid components of semen. When testosterone levels drop, these glands produce significantly less fluid, leading to noticeably smaller ejaculate volume. A study in the Journal of Andrology found that men with low testosterone had ejaculate volumes 40 to 60% lower than men with normal levels. But here's what men really notice and rarely talk about. The intensity and pleasure of orgasm diminishes dramatically. Orgasms feel muted, less satisfying, shorter in duration, and lack the full-body intensity they used to have. This happens because testosterone influences the rhythmic contractions of the pelvic floor muscles during orgasm. Lower testosterone means weaker, fewer contractions, which translates directly to reduced physical sensation and pleasure. Many men dismiss this, thinking, well, I'm older, of course it's not as intense. But that's not normal aging, that's hormonal insufficiency. When testosterone is restored to optimal levels, men consistently report that orgasm intensity returns to near what they experience in their 30s and 40s. If you've noticed your ejaculate volume has decreased noticeably, if orgasms feel like a pale shadow of what they used to be, and if you're thinking, what's the point? It doesn't even feel that good anymore. That's low testosterone speaking, and it's completely treatable. Number 3, significantly longer time required to achieve erection and delayed arousal response. This is about responsiveness. A man with healthy testosterone levels can typically achieve an erection within 1 to 3 minutes of sexual stimulation or arousal. If you're now finding that it takes 5, 10, 15 minutes of direct stimulation to get anywhere close to firm, or if your partner is working hard to arouse you and you're barely responding, that's a sign your androgen receptors aren't firing properly. Testosterone doesn't just affect desire. It affects the speed and efficiency of your entire arousal system. It's like the difference between a sports car that responds instantly when you press the accelerator versus an old engine that sputters and slowly builds power. Research from the Journal of Sexual Medicine found that men with testosterone below 300 nanograms per deciliter took an average of 340% longer to achieve full erection compared to men with levels above 500. This delayed response creates a vicious cycle. You need more stimulation to respond, which creates performance pressure, which increases anxiety, which further inhibits response. Many men start avoiding sexual situations entirely because the effort and time required feel exhausting and embarrassing. If this sounds familiar, the root cause is almost certainly hormonal, not psychological, and it's fixable. Number 2, complete inability to achieve a second erection within hours or even days after ejaculation, dramatically increased refractory period. When you were younger, you might have been able to go multiple rounds in a single session or be ready again within an hour or two. As testosterone declines, the refractory period, the recovery time your body needs between erections, extends dramatically. For men with very low testosterone, this can stretch to 24, 48, or even 72 hours. Some men report that after one sexual encounter, they feel completely depleted for days, with zero interest or ability to respond sexually. This happens because testosterone is required to reset your neurochemical and vascular systems after orgasm. Dopamine, prolactin, and nitric oxide levels need to rebalance, and without adequate testosterone, that process takes exponentially longer. A study in hormones and behavior found that men with low testosterone had refractory periods averaging 4 times longer than men with normal levels. If you used to be able to have sex multiple times per week and now once exhausts you for days, that's not just aging, that's profound hormonal depletion. And now, the number one bedroom sign that your testosterone is dangerously low: complete loss of spontaneous sexual thoughts, fantasies, and mental arousal throughout the day. This is the sign that indicates your testosterone has dropped to critically low levels, often below 200 to 250 nanograms per deciliter. A healthy man with normal testosterone thinks about sex multiple times per day, even if briefly. Sexual thoughts arise spontaneously when seeing an attractive person, when remembering past experiences, when relaxing, or even randomly throughout the day. This isn't about being obsessed with sex. It's about having a normally functioning male brain with adequate androgen stimulation. When testosterone drops to very low levels, this entire mental component shuts down almost completely. Men describe it as feeling neutered, or like their sexuality has been turned off at the source. You can go days, even weeks, without a single sexual thought entering your mind. When opportunities for sex arise, you feel indifferent or even annoyed rather than interested. This is fundamentally different from psychological erectile dysfunction or situational low libido. This is your brain literally not producing the neurochemical signals that create sexual interest because the hormonal fuel isn't there. Research from Psychoneuroendocrinology found that men with testosterone below 250 nanograms per deciliter reported sexual thoughts less than once per week compared to 10 to 20 times per week in men with normal levels. If you've reached this point, where sex barely crosses your mind anymore, where you feel like a completely different person from who you were sexually 10 or 15 years ago, you need to get tested immediately. This level of testosterone deficiency isn't just affecting your sex life. It's increasing your risk of cardiovascular disease, osteoporosis, diabetes, depression, and cognitive decline. So what do you do if you recognize 3 or more of these signs? First, get tested properly. Don't just ask for a testosterone test. Ask specifically for total testosterone, free testosterone, SHBG, which is sex hormone binding globulin, estradiol, and LH and FSH. These give a complete picture of your hormonal status. Get tested in the morning between 7 and 10 a.m. when testosterone is naturally highest. If you test low, get retested 1 to 2 weeks later to confirm. Normal ranges vary by lab, but generally, total testosterone below 300 nanograms per deciliter is considered clinically low. However, many men experience symptoms even at levels between 300 and 500. Optimal for most men is between 500 and 900. If your results come back low and you're experiencing these bedroom signs, work with a urologist or endocrinologist who specializes in male hormone health, not just your general practitioner who may dismiss it as normal aging. Treatment options include testosterone replacement therapy via injections, gels, or pellets, medications that stimulate your body's own production like clomiphene or HCG, and lifestyle interventions including strength training, optimizing sleep, reducing stress, and addressing nutritional deficiencies in zinc, vitamin D, and magnesium. Many men see dramatic improvements within 4 to 8 weeks of starting treatment. Morning erections return, libido resurges, erectile function improves significantly, orgasm intensity increases, energy and motivation come back, and the mental fog lifts. You don't have to accept diminished sexual function as inevitable. These are fixable, treatable problems. And there you have it. 7 bedroom signs that your testosterone is dangerously low. From decreased morning erections and reduced libido to erectile difficulties, dramatically reduced ejaculate volume and orgasm intensity, delayed arousal response, extended refractory periods, and complete loss of spontaneous sexual thoughts. If you recognize yourself in 3 or more of these, get tested. Don't wait years hoping it gets better on its own. It won't. If you found this information valuable, please hit that subscribe button so you don't miss our upcoming videos on testosterone optimization, natural hormone support, and men's sexual health solutions. Thanks so much for watching, and here's to reclaiming the vitality and function you deserve.